Acute Myocardial Infarction (AMI) definition. Acute myocardial infarction (AMI), commonly known as a heart attack, refers to the necrosis death of myocardial tissue due to prolonged ischemia, result of reduced or complete blockage of blood supply. Etiology cause arteriosclerosis, most common cause plaque formation, coronary artery thrombosis, coronary artery spasm, temporary tightening of coronary artery, embolism, blockage by a blood clot or other material. Cocaine use cause vasoconstriction, other condition vasculitis, coronary dissection, or severe hypotension shock. Pathogenesis, initial event, plaque rupture or erosion in coronary artery, thrombus formation, complete or partial occlusion lead to reduced oxygen supply, ischemia, myocardial cell lack oxygen, necrosis, prolonged ischemia over 20 to 30 minutes cause irreversible damage and death of myocardial cell. Inflammatory response, dead tissue trigger an inflammatory cascade result in the tissue repair or scar formation. Types of AMI: STE elevation, myocardial infarction, STEMI, complete blockage with significant ECG changes, non-STI elevation, myocardial infarction, NSTEMI, partial blockage with minor ECG changes but elevated cardiac enzyme. Clinical feature symptom: chest pain, severe crushing, retrocinal pain regarding to the left arm, jaw or back, shortness of breath due to impaired cardiac function, sweating, diaphoresis, cold, clammy skin, nausea or vomiting, autonomic response, fatigue or syncope, especially in older patients. Silent MI occur in diabetic cause early without significant symptom. Complication: early complication, arrhythmia, cardiogenic shock, acute heart failure. Late complications, ventricular aneurysm, Dressler syndrome, post-MI, pericarditis, recurrent infection. Diagnosis: electrocardiogram, ECG, STEMI, ST segment elevation, NSTEMI, ST segment decrease or T-wave inversion. Cardiac biomarker, troponin IT, most specific and sensitive marker, creatine kinase MB, CKMB, rise 4-6 hours after MI. Imaging: echocardiography, assembly valve motion abnormality, coronary angiography, detect blockage, microscopic pathology, early 0 to 24 hour, wave fiber, coagulative necrosis, inflammatory cell begin to infiltrate, 1-3 day neutrophil infiltration, interstitial edema, 3C day 1, macrophage clean and up necrotic tissue, 7 to 14 days granuloma tissue formation, weeks to month, fibrosis and scar formation. Management: medical treatment, antiplatelet, aspirin, clopidogrel, anticoagulant, heparin, beta blockage, reduce myocardial oxygen demand, stent, lower cholesterol level, repair fusion therapy, percussion, coronary intervention, PCI, preferred method, thrombosis, streptokinase or antiplaque, lifestyle modification, diet control, regular exercise, and cessation of smoking. Prevention: control risk factors like hypertension, diabetes, and hyperlipidemia, regular physical activity, health diet, low in standard fat and salt, avoid tobacco and alcohol. Prognosis depend on extent on myocardial damage and timely medical intervention, earlier treatment and significance improve outcome. Short note format: definition: necrosis of heart muscle due to ischemia, cause atherosclerosis, embolism, spasm. Symptom: chest pain, SOB, sweating. Diagnosis: ECP, troponin. Treatment: PCI, thrombosis. Medication, complication, arrhythmia, heart failure, uremia. The structure is suitable for answering question in university exam. Let me know if you would like